Welcome to your heart. First off, let me just go over the 4 chambers of the heart. We have the right atrium, the right ventricle, the left atrium, and the left ventricle. In between the right atrium and right ventricle, we have the tricuspid valve. The tricuspid valve. Here is the pulmonary valve or pulmonary semilunar valve. On the other side, we see the bicuspid valve, also known as the mitral valve. And if I move the mitral valve, way back there it is labeled 45. That is the aortic valve, or the aortic semilunar valve. So let's talk about the flow of blood through the heart. Deoxygenated blood coming from the lower portions of the body are going to return to the heart at the right atrium through the inferior vena cava, which is down here. The inferior vena cava. We have the right brachiocephalic vein here. That takes blood from the right side of the head and neck and the right arm. At number 18, this is the left brachiocephalic vein, taking blood from the left side of the head and neck and the left arm. Now, the right and left brachiocephalic veins merge together at number 16 to form the superior vena cava. The superior vena cava. Both the superior and inferior vena cava, or cavae for plural, are going to drain here into the right atrium. This is the right auricle here at number 2. So let's open up the right atrium. The right atrium has deoxygenated blood coming from the top portions and bottom portions of the body. From here, blood is going to pass through the tricuspid valve and enter into the right ventricle. This is the tricuspid valve. The strings here are the chordae tendineae, which are attached to the papillary muscles, and that acts to create tension on the valve to make sure it opens correctly and only in one direction. The heart is going to contract. When it contracts, it's going to push this valve closed. It's going to snap shut. It's going to snap shut here, and this valve is going to open. This is the pulmonary semilunar valve. The blood, at this point, is going to go through the pulmonary semilunar valve and enter into the pulmonary trunk, here. The pulmonary trunk. Now the pulmonary trunk is going to bifurcate or split into the right and left pulmonary arteries. Now these are all arteries. The pulmonary trunk is an artery, and the right and left pulmonary arteries are arteries. These arteries are colored blue because this is actually carrying deoxygenated blood. But remember, the definition of an artery is that it is going away from the heart. So we have the pulmonary trunk, which leads to the right pulmonary artery, which is going to the right lung. The left pulmonary artery is going to the left lung. At the level of the lungs, the blood becomes oxygenated. Now those veins that are oxygenated are going to carry blood back to the heart. Remember, a vein is any vessel going toward the heart. The way we get back to the heart from the right lung is through the right pulmonary veins. The right pulmonary veins, they carry oxygenated blood. The red blood cells here have just come from the lungs and they're fully oxygenated. Here are the left pulmonary veins, and they are veins because they're going toward the heart. These are red in the pulmonary circuit because they're carrying oxygenated blood. Both the right pulmonary veins and left pulmonary veins are going to drain into the left atrium. The left atrium. From there, blood is going to travel through the bicuspid valve, also known as the mitral valve. The mitral valve is going to function because it's attached to the chordae tendineae and the papillary muscles, which ensure this opens in one direction only. From this point, blood is going to travel through the mitral valve and enter the left ventricle. At this point, the left ventricle is going to contract. Let me see if I can give us a good view here. The left ventricle is going to contract, and here, at number 45, blood is going to travel through the aortic semilunar valve and then enter the aorta. The first branches that form off of the ascending aorta, which includes all of this, I can see one of the branches actually coming straight from the aorta. The other one's kind of hiding behind the pulmonary trunk. But the first branches that I have coming off of the ascending aorta are actually the right and left coronary arteries. The right and left coronary arteries. The coronary arteries supply the heart itself with blood because, just like everything else in the body, the heart needs blood too. Here at 31, this entire structure here is the right coronary artery. The right coronary artery. Now the left coronary artery is a little more interesting, and here we see just at one of the examples of the asymmetry we get with the circulatory system and the heart. Here is the left coronary artery. The left coronary artery is going to bifurcate or split. One branch is going to travel straight here, and this is the anterior interventricular artery. The anterior interventricular artery. The other branch is going to circle around. This is the circumflex artery. The circumflex artery. Once we get to this kind of big bulbous area here, we are at the coronary sinus. So here's the coronary sinus, and this is a better view of that inferior vena cava. The inferior vena cava. If you're wondering what this is actually the descending aorta or the thoracic aorta. This here is the esophagus. The esophagus. Here at number 21 is the back of the trachea, and these are the cartilaginous rings of the trachea. I'm bringing all of this together here just so you can have a more global view. Then, the trachea is going to bifurcate into the right and left primary bronchi. Now, because it's the back of the heart, right and left are switched. So this is the right primary bronchus and the left primary bronchus. If you're wondering what this is actually a continuation of this right pulmonary artery. So that's a continuation of the right pulmonary artery. So, this is the aorta, and the aorta includes the ascending aorta. Once I have these branches, this is the aortic arch. This structure here is called the ligamentum arteriosum. This is actually an artifact from fetal circulation. The ligamentum arteriosum allows the fetal circulation to bypass the pulmonary circuit completely. We have 3 blood vessels coming off of the aortic arch. The first branch is the brachiocephalic trunk. The brachiocephalic trunk is sometimes called the brachiocephalic artery, not to be confused with the brachiocephalic veins here. The brachiocephalic trunk. The reason it's called the trunk is it's going to bifurcate and separate into the right common carotid artery and the right subclavian artery. Here at number 14, this is the left common carotid artery. This is going to bring oxygenated blood to the head and neck. At number 15, we have the left subclavian artery. The left subclavian artery is going to feed oxygenated blood to the left arm. The reason this is called the subclavian artery is that it goes from the heart and then travels and kind of arches right below the clavicles. These are called the subclavian arteries for that reason. Thank you for watching.